Hi, I'm Alistair, Chief Pharmacist at Echo, and today we're talking about Ramipril. Ramipril is an ACE inhibitor, which is a sort of medicine that does a lot of things, but in this instance we're talking about how it can help you control your blood pressure. If you've got high blood pressure, it can end up leading to a lot of damage in later life, so it's really important to keep it well controlled. Ramipril helps to very slightly relax the blood vessels, so blood can flow around your body at a slightly lower pressure. Ramipril, when you first start taking it, can sometimes drop your blood pressure very low, and so it's a good idea to lie down fairly soon afterwards. Good idea probably to take it just before bed the first couple of doses. If you're lying down, you can't fall. Ramipril is a really good example of the sort of medicine where it's a good idea to get regular blood tests and check that things like your sodium levels, your potassium levels, all sorts of things like that are well controlled. If any of the numbers come back a little bit out, your GP can give you some advice on how you can change that in terms of salt intake, in terms of what you're eating. There's lots that you can do to help out there. One of the things that contributes to having high blood pressure the most is how much salt we have in the food that we eat. NHS guidelines very clearly state we should be aiming for 6 grams or less every single day. That's for adults. One of the things with guidelines is it's sometimes difficult to visualise what that means. So in order to help you reduce the amount of salt in your diet and therefore reduce any risk of high blood pressure, we thought we'd show you what those guidelines look like in action. So here's a day's worth of salt. Not too much, most of us are having more than that every single day. Here's a week. It's a lot of salt. You could cut back on that and probably not miss it too much. What does a year look like? That's quite a lot of salt. And wait, we're not done just yet. This is a year. That's a year of salt. We can all cut back. For some hints on how to cut back on the amount of salt that you've got in your diet, check out the links that we've got below. There's some really good NHS guidance on salt, on changing your food habits, and it's something we can all do to help ourselves.